right. Thank you, Teresa.
Thank you. So welcome. Thanks for coming in this weather, of course. My name's Teresa Mealy. I'm a family nurse practitioner, and I've been a family nurse practitioner for 20, going on 21 years. But I've been doing hormone replacement for about the last 10. And I got into it because I had my own issues. And so my title of my talk is The Devastating Effects of Women Living Without Hormones. And I'm going to go through the lifespan of a female. Now, I did make notes and I separated age groups and put symptoms in there, but it can happen at all different times of the lifespan, okay? But this is what women are dealing with, unfortunately. Now, number one, there is not a lot of data studied on menopause. So when you guys think of, I won't have you say it out loud because I know I'm very quiet in settings like this, but when you think, oh, I have a yeast infection, or I need birth control, or my periods are weird, you think of GYNs. GYNs learn hormonal health in the reproductive age, like giving women birth control pills or IUDs. They learn how to deliver babies. They learn how to take out uteruses and ovaries. They do not learn menopause. So the GYNs that you are going to for perimenopause and menopause do not learn that in school. You have to really step outside of that to learn it. So I always say my husband and I spent way more money learning hormones and food, because we also do metabolic health and fitness at our office, than I ever spent on my master's degree going to University of South Florida. So interestingly enough, the other thing that most people don't know is women were not involved in drug trials until the 80s, when people finally said, you should let women, because we're reproductive. So you never know when women sometimes don't know when they're pregnant. So it wasn't until like 1986 that they said we should have a policy that allows females in studies. That didn't actually happen until they made it into law in the 90s. And the Women's Health Initiative was the first big female study, which is what everyone hangs their hat on about hormones. The Women's Health Initiative was one study released in 2002, flawed, should be retracted, but it's not. That's what everyone talks about, hormones cause breast cancer. There's literally hundreds of other studies showing the benefits of hormones, but we only talk about the Women's Health Initiative. So the average age of menopause is 45 to 55, okay? I actually have been on hormones since I was 42, progesterone, testosterone, and then thyroid. Many of my patients get thyroid optimization, but I actually have thyroid disease and Hashimoto's. But I started estrogen on my 50th birthday. So 45 to 55 is perimenopause, or menopause, and peri can happen 10 years before that. For some women, they go through 20 years of hell while they're trying to get hormones figured out. I had one patient who came to me when she was 72. She's probably been with me for 5 years now. She had hot flashes and night sweats every day of her life, all day long, from the time she went into menopause until the time she saw me 20 years later. And I put her on all the hormones, but it's the estrogen that then she stopped having hot flashes and night sweats. The doctors just kept saying, you'll get through it. Once you get through it, it'll go away. This is just a stage of life. This is a rite of passage, is what they say a lot. So I'm going to tell you based on what I've heard over 10 years with thousands of patients. So 100% of women will go through menopause. We can't say 100% of women will get blood pressure issues or diabetes or break their foot, but we can say that 100% of women go through menopause. Of those 100% of women, in your head, you don't have to say it out loud, guess how many people are on hormone replacement therapy? 7% of women are actually on hormone replacement therapy. 15% get offered hormone replacement therapy. In perimenopause, depression and anxiety sets in. So many times I hear women say, I'm a shell of myself. I don't even recognize myself. I just don't feel like myself. Those are the main things. I have chills on my head because I hear it so much, and the pain in their voice, and I was there, but the pain is so apparent. So 15% are offered when vaginal estrogen is safe for every woman, including breast cancer survivors. So they could at least have relief from vaginal dryness, painful sex. Some women say it feels like there's shards of glass when they have sex. I had one woman recently tell me her sex is so painful, she's in her 70s, that she does it with the lights out so her husband can't see her cringing the whole time. I had another woman tell me She prays that her husband would get erectile dysfunction because she doesn't want to have sex. And I was like, let's not do that. Let's rebuke that. Let's pray right now that that doesn't happen. And let's fix the low libido issues. So 7% are actually on hormone therapy. That means if you look up the population of the United States and the amount of women that we have, there's 167 million women in the United States. 156 million of them are not getting health prevention, disease prevention care. They're just being left to suffer. And you all know you just get called histrionic and crazy. So, okay, with that being said, let me first tell you that some women don't really feel these obvious things like anxiety and depression, and you've met them. But the health-related, age-related diseases, everyone is going to be affected by. So let me just go over very quickly the hormones that we're talking about. Progesterone and estrogen should be balanced. Progesterone goes first in our late 30s, and that brings about, I say it makes you crazier than God made you. You just become irrational, illogical, overwhelmed. You don't handle situations well. You don't like your husband. Your family annoys you. Everyone breathing makes you crazy. And you start to have weird, wacky periods. And that's where women will start to get hysterectomies. If they go to the doctor, you tell your GYN you're bleeding too much, they're going to take your uterus. That's progesterone. So I say she is the hormone of contentment, helps with anxiety, depression, sleep, and an evenness of mood. Unfortunately, people will get on hormones and have a catastrophic event in their family, and they come back to me fairly quickly and say, I handled that way better than I would have if I wasn't on hormones, okay? So then eventually estrogen falls, and then you get hot flashes, night sweats, vaginal dryness, painful sex, later on osteoporosis, which we've been able to reverse in the office, takes about 2 or 3 years, heart disease and Alzheimer's and dementia. Good studies in the neurology journals showing if you get men or women on with early onset dementia on estrogen, and men get estrogen from testosterone, they just don't get as much as we naturally make, you can prevent dementia. Now, we also know dementia is type 3 diabetes, severe insulin resistance of the brain, and we all know there's a statin epidemic, which is cholesterol medicine, and that causes cognitive decline and diabetes. So, and then testosterone is a cream, and for both sexes, it's sex and muscles. If you want a libido, you have to have testosterone. If you want muscle mass, which we do, which that's a whole nother talk about metabolic health and fitness, you have to have lean muscle for longevity. The main things that send women to the nursing home is frailty and urinary symptoms, okay? So frailty, we need lean mass. So muscle mass is testosterone and sex drive is testosterone. But besides that, it is zest, vitality, motivation, strength, stamina, get up and go, get your list done. All the hormones help with anxiety, depression, blood pressure, cholesterol, heart disease. There's no way I would have built this business for the last 10 years without being on hormones. I was a shell of myself. I couldn't get out of bed. My husband's up here at the front. He took care of the kids day and night. And I just was like, Lord, every morning I would wake up, I would think, Lord, you woke me up again. Like, this is not fun. I really don't care if I wake up again. My husband's an excellent father. He's very present and all that stuff. So anyway, he kept me alive to be here today to tell you guys this stuff. Okay, so let's start, and I'm going to start 30 to 35 age group, but hormonal problems in young girls is PCOS, polycystic ovarian syndrome, menstrual migraines, severe PMS, and when girls and women bleed through pads and tampons in 30 minutes, that's a hormonal problem, okay? But I'm going to start at 30 to 35 because I'm talking about menopause. So 30 to 35, you start to go to your doctor. It doesn't matter if it's your gynecologist or your primary. It doesn't matter if they're an MD, a DO, a nurse practitioner, or a PA. You start to tell them, I just don't feel like myself. My focus is off. My memory's bad. I have severe brain fog. I have fatigue. I can hardly get out of bed. My libido's shot. I don't even want to have sex. And most of these women actually like their husband. Like, I liked my husband. And I thought he was pretty handsome, but I don't want to have sex with him. So, and I didn't like I love my kids, but like, they're annoying. And it was kindergarten homework that sent me over the edge, that the first time my husband was like, something is wrong, because this is connect the dots and color and a shape, and you're freaking out. So what they get diagnosed with is ADHD. They get put on Adderall. They get told she's getting older. They tell you to try a glass of wine to tranquilize yourself through sex. and they go about their business. And now they've got one medicine, Adderall, which creates sleeping issues and other things. So then around 35 and up, you go back to this doctor and you say, my anxiety is way worse. Now I got depression. I still got low libido. I have feelings of despair. Like, I remembered the twice I've had a panic attack, postpartum, which is hormones. And the day I had a panic attack on the streets of Orlando, I figured out I was in menopause, and then it just completely relieved. But I have had a sense of doom in my belly. He came home one time for traveling, and I just sat on the stairs in our house and I said, someone's going to die. He's like, what? I said, I don't know. Someone's going to die. Something bad is going to happen. It's a sense of doom, despair. I'm moody. I'm irritable. I can't stand the people around me. She's told again she's getting older. I have 39-year-olds that come in that get told they're getting old. 39. Okay, you're not.
Yeah, you tell them.
And then she gets told she's also a mom. This is how it is being a mom. It's kind of stressful. You got little kids. They're in sports, And then she gets put on an SSRI like Zoloft, Paxil, Lexapro, which you don't get an informed consent really at most offices when you get put on any kind of medicine. But they forget to tell women that it's very difficult to get off these SSRIs. I have women that have been on it for 30 years. So why did you go on it? Well, I was going through a divorce. Well, you should feel pretty terrible when you're going through a divorce. You should feel anger, sadness, frustration. What am I going to do with my life? I don't think you need an antidepressant. And if you do, you don't need it for 30 years. But they are not in the business the way our healthcare, which I call sick care, is not in the business of getting people off meds once they get on. But hormonal depression and anxiety does not respond to SSRIs or even NSRIs, the non-selective serotonin reuptake inhibitors. You need hormones. So now she's given a SSRI. She complains about libido, weight gain. Everyone says, I have never been this heavy in my life and I have never had belly fat. That's hormones.
Anybody relate to that?
Right. So she gets put on these SSRIs. What do? They cause weight gain, they cause decreased libido, and they cause an inability to orgasm. So do you think that has helped the libido issues? First of all, no one wants to have sex when they don't think they look cute. You want to have the lights off and all that. You're just not interested, okay? So now she's on Adderall and Lexapro. Let's just say Lexapro. So now we're at 40 and up. Widespread fatigue, can't get out of bed. Hard to get out of bed. Low libido. Now it's causing issues in the marriage. Muscle aches, severe fatigue. You can get hip pain in menopause. You can get frozen shoulder in menopause. You can get itchy ears, tinnitus. It's widespread. It affects every organ system in the body. So severe fatigue, insomnia. Now she has insomnia. Anxiety, depression, worry, weight gain. Now she's diagnosed with fibromyalgia. Now she gets gabapentin, which causes insulin resistance or diabetes. She also gets prescribed an increased dose of the Lexapro. So maybe she started at 10. She's still on the Adderall. Now she's on Lexapro 10. Now she's on Lexapro 20. Now she's on gabapentin. And then she's told to get counseling regarding the sex drive. You should probably see a sex counselor. And then she's always told to eat less and move more, which has never worked. Calories in, calories out is thermodynamics, and it was never meant to be part of the human body. It is not a way to lose weight because we've all tried that. If it was that easy, we would not have any issues with obesity. Okay, 45 and up. This is, in my opinion, this is where marriages start to fail. What happens is women are made with a lot of estrogen, men a little bit, women a lot. That allows us to be accommodating, nurturing, flexible. Your husband wants to go play golf all day Saturday and half the day Sunday. You're like, oh, okay. Once estrogen starts to fall, you become a little less accommodating, a little less flexible, a little more like, what the heck is happening in this house? And a little more, I'm not dealing with any of this. Now you've had marital problems for about 10 years that have really come to a head because now you're losing hormones. So 45 and up. Decrease in estradiol makes women less tolerant, less flexible, starting to speak their truth. So now your husband's like 20 years in, he's like, what do you mean? You don't like the way I'm acting? You don't like the way, like, this is how we've been doing it. Okay, so then they kind of get blindsided. Cholesterol increases. So now you get put on atorvastatin or Lipitor, which causes cognitive decline and insulin resistance and diabetes in 67% of the people that go on it, not to mention all the other bad things. Zero libido. Now you're like, hiding in the closet when you're changing, because there's no way you're going to let your husband see your boobs because you're not doing anything. Don't even look at me. So it's gone. It is zero. Osteopenia starts. You continue with brain fog, trouble finding words. Now you're getting hot flashes and night sweats, and all the previous symptoms are becoming worse. And you still get offered the same tried and true. You're getting old. You're a mother. Go to counseling. All of that. So I had one patient, so I just put this in this age group. She was told when she told her GYN, it's a female GYN too, that she had zero libido. She said, you should get better lingerie. And I was like, well, that will surely help your husband, because they are visual people, and they don't need lingerie. They just need to see you naked. Okay, so get better lingerie. And then I had another guy in West Plains tell one of my patients, just put the fork down and push the chair away from the table, because she was complaining. Right? This is what I hear every single day from multiple people. I mean, okay, so 50 and up, same issues as we've been talking about, but now full-blown osteoporosis with vertebral fractures. There was a week span a few weeks ago that I had 3 people in the same week, and I only work 3 days a week, with osteoporosis, spontaneous vertebral fractures when they stand up, painful, life-altering, disabling. Bladder issues with incontinence, interstitial cystitis, chronic UTIs. So now she's prescribed Prolia injections for osteoporosis and all those other things, which slow down bone loss. Hormones actually build bone, and some of those medicines can help build bone, but it's chaotic in structure. It's not like the God-given hormones that we were designed with and born with and made to have. Now, the thing is, people always say, well, why would I go on hormones if God made me like I am? Well, we live longer now. So you can live to 99, which I'm not interested in living to 99 if I'm in a nursing home, peeing myself, and I don't know who people are. I don't want that. But you can live, there's the average lifespan now for females is in the upper 70s or early 80s. So you live a lot longer, and to live that long without hormones can be devastating. Okay, so she's told to go on date nights for the low sex drive. Okay, and then she's told she's getting old, and this is all expected. 55 and up, same issues as before, but now you have insulin resistance. So as you age naturally, which we could, again, do a whole nother talk on metabolic health. As you age, you get insulin resistant. As you lose hormones, you get insulin resistant. If you're doing all of those things, you're losing muscle mass and now putting on fat. So that's why exponentially now you're gaining and gaining and gaining. You can't go down no matter what you do. I mean, patients do tell me, I starve myself. I don't eat at all, but I can't lose weight. So same issues as above, plus insulin resistance. Now they have high blood pressure, of course, vaginal dryness, painful sex, pelvic pain, genitourinary syndrome, which just means chronic UTIs and all of that. It also means it's thinning and inflammation and drying of the vaginal tissues. So sex is not fun. It is not comfortable. It is extremely painful. And again, vaginal estrogen is safe for any woman, even breast cancer survivors. Breast cancer is not caused solely by hormones. Most breast cancers, first of all, it's multifactorial. And those that are critical thinkers already know this. It's environmental. Majority of breast cancer is environmental. There are tons of endocrine disruptors mimicking estrogen. So even if you get diagnosed with an estrogen receptive breast cancer, you don't know if it was your estrogen that God made you, because most of the time those women are postmenopause. And I can tell you from doing thousands and thousands of lab work on postmenopausal women, there's zero estrogen in their blood and there is zero progesterone in their blood. So it's not feeding a cancer. So, okay, and then urinary incontinence, which again is one reason women end up in the nursing home. And then 60 and above, same issues as above. Now you have significant hip pain, arthritis, worsening of osteoarthritis, imbalance, macular degeneration, which is helped with estrogen, setting her up for falls and hip fractures, frozen shoulder, I already said that, now increasing frailty, which leads you to a nursing home. Right, we got dealt the bad hand for sure, but what'd you say?
I said thanks, Steve.
Right, but I think the problem, and I think it's changing. It has to be changing because Mary Claire Haver is an OBGYN. She just wrote the book, The New Menopause. Dr. Avram Blooming wrote the book, Estrogen Matters. He's an oncologist whose wife had breast cancer, and he told her you can't ever go on hormones. And she came to him. I'm paraphrasing what I think she said. She came to him and said, I am going to cut somebody if you do not help me. So he went and studied the literature, the Women's Health Initiative, and all that stuff, and was appalled that he parroted what is not true. I was going to say Dr. Haver just went on Oprah. So there's a lot of attention coming to this problem that women are not getting help for. So providers are either going to have to step up and say, go learn it, or step up and just say, I didn't learn this, I don't know it, but there are plenty of hormone providers in the city. So go to one of them. That's what they need to say. They just need to say, I don't know about hormones. Not hormones are dangerous. Don't give misinformation, okay? So what can you do? Ask the correct provider about hormone replacement therapy, not just a regular provider, because they're going to say it causes cancer. Don't do that. Ask the correct provider, and then read the right material for correct information. And one of those, or both of those books I just mentioned by Dr. Mary Claire Haver, Naomi Watts, the actress, just wrote a book on menopause because she was pretty appalled at what she went through. And by the time she figured it out, it's like, well, I didn't have this information before. So yeah, that's pretty much all I got. I don't know how much time I took, but okay, good. It's a good thing I talk fast.
Are there any questions here? I know some people came specifically for Teresa about hormones, so make sure you ask them of her.
Like younger women, like, you know, maybe in their late teens, early 20s, that are having like very painful PMS, but their periods aren't like extremely heavy or irregular, like a lot of cramping. Is that hormonal?
It can be. So the question is younger women that are having a lot of cramping with periods. So there is something PMDD, which is premenstrual dysphoric disorder, and that is where young women with their period will get suicidal. Like the anxiety and depression is off the charts, and it's cyclical. So I had I think she was 21. She was the daughter of one of my patients. She brought her in, and she starts telling me she's been admitted to the psych unit. This is the third time. And finally I said, were you on your period every single time you got admitted? And she said, I don't know, let me think for a second. She goes, yes, I started my period, and they don't have all you women that have had babies, those postpartum pads. She's like, they brought me this big diaper thing. I was on my period. So she got diagnosed with PMDD, and that can be relieved with progesterone.
Yeah, and you don't think about that for like teenagers.
No.
You know, sometimes they want you to go on the pill.
Yep.
But the pill is usually estrogen based.
Right.
And so you have
Makes
to
it
be
worse.
careful about that.
Yep.
But a good doctor,
Right.
you know.
I also had a patient of a daughter of one of my patients, and she was everything I periods out of this world, couldn't get up, couldn't focus, couldn't study, dropped out of school. She was going to school to be an occupational therapist. I got her on progesterone. That was it. It's pretty easy. And she graduated, I think, last year with her OT degree. So, you know, why are we doing this to people, to women?
But I do get calls a lot from women who are having a lot of these symptoms. They're scared to death.
Yeah.
And even mama's calling me. I don't know, is Dana here? Dana was going to bring her daughter today because she has all these problems, and she's only like 17.
Oh.
And they don't know what to do for that. And Teresa is a good resource. So I want you guys to be able to know that, because she can help when you have these issues that come up.
Yeah.
That you're, I don't want to say doctor in quote, but they're just not trained.
They're not trained.
So that's the issue.
And young people, and a lot of this can also in the early years can be mitigated by food, again, which is another talk, metabolic health.
Oh, the question I had was that a couple of times you said the doctors just aren't taught this.
Yes.
Is there any movement in any of the medical schools anywhere?
No, because the medical establishment is predicated from the early 1900s on pills for an ill. So they are not, now I'm not saying all, but if they do, they have to slip notes to patients like, you should look this person up. But we're not designed to get to root causes anymore, and we're not designed to heal. We are designed to keep in the system. Now, I'm not saying you go to Dr. Smith and he knows that, like, oh, I got to keep this person in the system. I got to keep this person sick. He doesn't know that. That's just how the system was designed. Even in nursing school, you only learned a diagnosis, and then the last part of the chapter was like 3 pages of meds that went with, these things that you read about. Yes.
Do you have any recommendations
Dry eyes can be caused from, yep. So dry eyes can be helped with testosterone. So I have patients, men and women, put testosterone on their scrotum or vaginal tissue, but even that can absorb into the eyes and can help that significantly. Mm-hmm.
Oh, and speaking of, there's a lot of practitioners who aren't willing to give
Yes,
women, say, over 1 milligram of testosterone, which for me does nothing.
correct.
So what dosage do you recommend for cream?
Okay, so
I don't know so much about the pellets.
the question is the dose of testosterone. So a lot of providers are nervous to test or to give testosterone. The second you send a testosterone, like a hydrocodone script in, you're on the DEA alert, their radar. So I do notice a lot of clinics in town will put you on something so minor like 1 milligram and then say, I guess testosterone didn't work. I am looking for libido. So until I get libido, I'm bumping it up. Now there gets to be a point, I do bring patients in and I say, we got to have a come to Jesus. Do you like your husband? And honestly, most of them, all of them have said, I do. I really like him. Like, he's great. So then I got to figure out, if I get up to a certain level of testosterone and libido is not there, libido for females is tricky. Men want to eat and have sex. There's a lot of complex problems with our libido, resentment, bitterness, fatigue. Is he helping enough? All of that kind of stuff can play in there too. But the dose of testosterone that is needed is the dose that gets libido going.
And do you recommend just putting it on that?
I do.
Or on the body?
I do cream vaginally because vaginally or the scrotum is the best mucus absorber and a mucous membrane, so the best absorption. If you want to put it on the back of your knee, I have some women that want to do that. Like some women who still have their period. When they have their period, they put it on their knee. If you're going to routinely do that, I typically have to raise the dose because it's not as absorbed on the skin. Mm-hmm.
But and if you put it inside the vagina?
No, just on the outer parts. Yeah, like on the labia.
Do you have a question?
She was first.
Hi,
Hi.
Sarah.
Do you think supplementing with DHEA can ever get the levels up to where you think is acceptable?
Excellent question. So the question is DHEA. DHEA is known as the mother hormone, and it does metabolize into estrogen and testosterone. But I've not seen that to levels I need them. I'm looking for certain levels of estrogen and progesterone to build bone, prevent osteoporosis, and by doing thousands of labs, I still have to raise women's progesterone and estrogen, and I have most of them on DHEA.
Okay. Can you share where to get those numbers? Like what?
So there's no standard. It's just numbers that I've learned in a conference. But it's not standard. Estrogen, I'm looking for a minimum of 60 and above. Progesterone, you need at least 10 and above to offset the estrogen. Estrogen is proliferative. She does grow cells. So you want progesterone opposition to maintain your estrogen. What standard of care? First of all, hormones that I'm doing is not standard of care. Pregnant horse pea and the synthetic progestin, which is Provera, which did cause breast cancer in the Women's Health Initiative, that is standard of care. But standard of care is so when I tell you at the beginning, progesterone is the hormone of contentment, helps with anxiety, depression, evenness of mood, and sleep. But then standard of care is if you don't have your uterus, you don't get it. I didn't mention anything about your uterus. I said you're going to handle situations better, but if you don't have a uterus, you don't get progesterone in healthcare, which is good because you just get Provera. So, and that's bad. So.
You mentioned insomnia or sleep issues.
Yes.
I've had chronic sleep issues all my life.
There are some people like you that will tell me it's been since I was a teenager, or my parents said I was a lousy sleeper. But when you're talking about perimenopause, it also can make it worse, or that's when it initiates. Progesterone is the answer. You could do melatonin, L-tryptophan, CBN oil, magnesium glycinate, glycine,
Vagal nerve stimulation.
Yeah, like
so that,
blue light glasses, decreasing screen time. I mean, all of those things. We should be able to find your puzzle to sleep, because if you don't have sleep, you will always be insulin resistant. And if you don't have sleep, you can never be fully healthy.
You're in Arkansas.
I am in Missouri and Florida. I have license in Florida and Missouri.
Okay, where at?
Springfield.
Oh, you're in Springfield.
Yeah.
So does Dr. Bolin at Camp Farmer, does she also do hormone stuff? Do you know?
I don't know that.
I don't know if she does. I mean, she is an MD, and I know she's more open to things, so you might could ask that question.
Yeah.
Because I'm
not
closer
sure.
that direction.
Yeah.
So,
Yes.
I don't understand how the medical community, conventional medicine can still only offer the standard of care, which has been shown clinically to cause breast cancer because of that health initiative study in the 90s. How can they still, from a medically ethical standpoint, tell patients that's all they can offer? I mean, is that not considered against their medical oath that they take? Is that, I mean, that's
So the question is, why does the medical establishment still offer something that they know is harmful and not offer hormone replacement therapy when we have studies? These are the conversations that I have every single night with Mark, and my boys who will be 18 spout this off too. Money. And they like to use the Women's Health Initiative to say it causes breast cancer, we can't do that. And then it frees them up from everything. It takes a lot of work and I have quite a few patients in here, a lot of work and a lot of nuances. You're constantly talking to some people that I can't get their periods under control, or you're dealing with marriages and all of these other things that you call an office here and you talk to. One time I called to schedule with a GYN at Mercy, and I talked to someone in Kansas City scheduling for over here. So your best bet is to get out of that. What I say is get out of that system. I say it every night on YouTube. I say it every night on Facebook. Get out of that system. And then I just started seeing a lady, and she said, my husband's kind of annoyed because we can't use our insurance. I was like, you can use your insurance in a system that doesn't care about your health. So you have to choose. So stop going out to eat one night a week, because there are lots of people. So first of all, I had a patient tell me he spends $800 a month on liquor. And I have other patients who eat out every single day, at least for dinner. So you could pull back some of that spending and get some money to see people like me.
Where can we find you on YouTube or these different places?
So is it Total Health and
Yeah,
Wellness?
so it's TM, the initial is TM, and then Total Health and Wellness. It's the same thing on Facebook as well, TM Total Health and Wellness.
TM Total Health and Wellness. We just rebranded, so now I'm yeah. So anyway, we do What's for Dinner most nights, talking about metabolic health and hormones. Yes?
What would be the main concern about DHE levels in the blood being too high?
DHEA levels, I do see that occasionally. Worst case scenario, something wrong with the adrenals, something like a tumor or something that's on the adrenals, which sit right above the kidneys. But some women just naturally make it. PCOS women make high androgens, testosterone and DHEA. And so sometimes that carries into menopause. Many times it will abate, but I do have a couple women that it's still elevated in menopause. So just looking into like with tests, CAT scans or something.
All right, thank you.
Oh.
We'll have one more, that'll be the last one.
I have been listening to Barbara Neal.
Yeah.
And she was saying progesterone will balance the testosterone, the estrogen and the testosterone. If it's too high, it'll bring it low. If it's too low, it'll bring it high. Is that true?
Progesterone. So what I think mostly with that is sex hormone binding globulin. If you have low, which if you're insulin resistant, it's high, and that binds to all the hormones, so then you can't really utilize them. So you want sex hormone binding globulin low. I don't find that in my practice, but I am aggressive, and I make doses so I get certain levels. So, yeah.
All right, well, thank you.
Thank you so much, everybody.
You guys,